Are there new HER2-positive breast cancer therapies being studied? Imagine a future where breast cancer treatments become more precise, less harsh, and more effective. Researchers are actively exploring new options for HER2-positive breast cancer, a subtype where cancer cells have high levels of the HER2 protein that fuels tumor growth. While current treatments have improved outcomes significantly, ongoing studies aim to find even better therapies. Today, the main treatment for advanced HER2-positive breast cancer involves a combination of chemotherapy and targeted drugs like trastuzumab and trastuzumab. This is often called the HER2 regimen. For early-stage disease, patients usually get chemotherapy along with HER2-targeted therapy before surgery, then have surgery and additional therapy afterward. But scientists are always looking for ways to improve these protocols. One of the most exciting developments is a drug called trastuzumab deruxtecan, also known as Enhertu. It is an antibody-drug conjugate, which means it uses an antibody to deliver chemotherapy directly to cancer cells. In recent clinical trials, combining trastuzumab deruxtecan with trastuzumab showed promising results. Patients receiving this combination had a median progression-free survival of over 40 months, compared to about 27 months with the standard therapy. Some patients even had no detectable cancer after treatment. Because of these strong results, the U.S. Food and Drug Administration has granted breakthrough therapy designation to this combination, indicating it could become a new standard for metastatic HER2-positive breast cancer. Researchers are also exploring whether some patients with early-stage disease might be treated effectively with less chemotherapy. The goal is to reduce side effects without sacrificing effectiveness. Early results from trials like CompassHER suggest that many patients with HER2-positive, estrogen receptor-negative tumors can achieve complete response with less chemotherapy, which is very encouraging. However, longer follow-up is needed to see how these approaches affect long-term outcomes. Beyond these options, scientists are studying other drugs and treatment sequences. For example, drugs like tucatinib are being tested in combination with existing therapies, and researchers are investigating how to best sequence antibody-drug conjugates if the cancer becomes resistant to current treatments. They are also working on better ways to measure HER2 levels in tumors, which could help personalize treatment plans even more. All these advances mean that in the future, patients may have access to therapies that are more effective and less toxic. The hope is to extend the time without cancer progression, increase the chances of complete remission, and reduce the need for harsh chemotherapy. But it is important to remember that these treatments are still being studied and are not yet widely available outside clinical trials. While the progress is exciting, it also raises questions about the best way to use these new therapies, how to manage possible side effects, and which patients will benefit most. It's essential for patients to discuss all options with their healthcare team, as treatment decisions should always be personalized based on individual health and circumstances. In summary, yes, new therapies for HER2-positive breast cancer are actively being studied. The most advanced is the combination of trastuzumab deruxtecan and trastuzumab, which has shown promising results and is under review for approval. For early-stage disease, researchers are exploring whether less chemotherapy can still be effective. Ongoing studies are also investigating other targeted drugs and treatment sequences. These developments reflected the rapid progress in breast cancer care, but further research is needed to fully understand their long-term benefits and risks. If you or someone you know is affected, talking to a healthcare professional about clinical trial options and the latest treatments is always a good step.